Hello, and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to Central Venous Access Devices, CVADs, tailored for any exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's start. A nurse is caring for a patient with a newly inserted central venous catheter. The patient reports discomfort and swelling at the catheter insertion site. What is the nurse's priority action? A. Administer an analgesic as ordered. B. Apply a warm compress to the insertion site. C. Assess for signs of infection or thrombosis. D. Document the patient's complaint and continue monitoring. Answer 1. C. Assess for signs of infection or thrombosis. Rationale. Discomfort and swelling at the central venous catheter insertion site could indicate infection or thrombosis. The nurse's priority is to assess for signs of complications to ensure timely intervention. Question 2. A patient with a central venous access device experiences sudden difficulty flushing the catheter. What is the nurse's initial action? A. Attempt to flush the catheter with more force. B. Notify the healthcare provider. C. Administer a thrombolytic agent. D. Document the finding and continue routine care. Answer 2. A. Attempt to flush the catheter with more force. Rationale. If a patient experiences difficulty flushing a central venous catheter, the initial action is to attempt to flush the catheter with more force. Gentle flushing may help clear any obstruction. If the issue persists, further intervention and provider notification may be necessary. Question 3. A nurse is preparing to administer medication through a central venous access device. The medication is known to be vesicant. What is the nurse's priority action? A. Administer the medication as ordered. B. Dilute the medication with normal saline. C. Apply warmth to the catheter insertion site. D. Check for proper catheter placement. Answer 3. D. Check for proper catheter placement. Rationale. Vesicant medications can cause tissue damage if they extravasate. The nurse's priority is to ensure proper catheter placement and verify that the medication can be safely administered through the central venous access device. Question 4. A patient with a central venous catheter develops a fever and chills. The nurse suspects catheter-related bloodstream infection, CRBSI. What is the appropriate nursing action? A. Administer prophylactic antibiotics. B. Remove the central venous catheter. C. Monitor vital signs and continue observation. D. Increase the rate of intravenous fluids. Answer 4. B. Remove the central venous catheter. Rationale. In the presence of symptoms suggestive of catheter-related bloodstream infection, CRBSI, the appropriate nursing action is to remove the central venous catheter. Prompt removal is essential to prevent further complications and the spread of infection. Question 5. A nurse is caring for a patient with a peripherally inserted central catheter, PICC. The patient reports pain and numbness in the arm with the PICC. What is the nurse's priority action? A. Elevate the arm to promote venous return. B. Assess for signs of nerve injury. C. Apply a cold compress to the arm. D. Continue routine care and monitor for changes. Answer 5. B. Assess for signs of nerve injury. Rationale. Pain and numbness in the arm with a peripherally inserted central catheter, PICC, may indicate nerve injury. The nurse's priority is to assess for signs of nerve injury and take appropriate action, which may include adjusting the position of the catheter. Question 6. A nurse is caring for a patient with a tunneled central venous catheter. The patient reports sudden chest pain and difficulty breathing. What is the nurse's immediate action? A. Administer oxygen and call for help. B. Assess the catheter insertion site. C. Administer a thrombolytic agent. D. Increase the rate of intravenous fluids. Answer 6. A. Administer oxygen and call for help. Rationale. Sudden chest pain and difficulty breathing in a patient with a central venous catheter may indicate a potential life-threatening complication such as a pneumothorax. The nurse's immediate action is to administer oxygen and call for help. Question 7. A patient with a peripherally inserted central catheter, PICC, is scheduled for a magnetic resonance imaging, MRI, scan. What action should the nurse take before the procedure? A. Remove the PICC and insert a new one afterward. B. Place a non-ferromagnetic securement device on the PICC. C. Administer a sedative to minimize patient movement. D. Deactivate the MRI machine during PICC exposure. Answer 7. B. Place a non-ferromagnetic securement device on the PICC. Rationale. Before an MRI, it is essential to place a non-ferromagnetic securement device on the peripherally inserted central catheter, PICC, to avoid interference with the magnetic field. Removing the PICC is unnecessary if appropriate precautions are taken. Question 8. A nurse is caring for a patient with a central venous catheter that accidentally becomes disconnected from the tubing. What is the nurse's immediate action? A. Reconnect the tubing and flush the catheter. B. Assess the patient for signs of catheter-related complications. C. Clamp the catheter to prevent air embolism. D. Document the incident and notify the healthcare provider. Answer 8. C. Clamp the catheter to prevent air embolism. Rationale. If a central venous catheter becomes disconnected, the nurse's immediate action is to clamp the catheter to prevent air embolism. Assessing the patient and notifying the healthcare provider should follow this action. Question 9. A patient with a central venous catheter is receiving total parenteral nutrition, TPN. The nurse observes a cloudy appearance in the TPN bag. What is the appropriate action? A. Administer the TPN as scheduled. B. Discard the TPN and obtain a new bag. C. Warm the TPN bag to room temperature. D. Add additional vitamins to the TPN solution. Answer 9. B. Discard the TPN and obtain a new bag. Rationale. A cloudy appearance in a total parenteral nutrition, TPN, bag may indicate bacterial contamination. The appropriate action is to discard the TPN and obtain a new bag to prevent infection. Question 10. A nurse is caring for a patient with a central venous catheter. The patient suddenly develops chest pain, shortness of breath, and hypotension. What complication should the nurse suspect? A. Catheter dislodgement. B. Air embolism. C. Catheter-related bloodstream infection. D. Thrombosis. Answer 10. B. Air embolism. Rationale. Sudden chest pain, shortness of breath, and hypotension in a patient with a central venous catheter may indicate an air embolism. The nurse should suspect this complication and take immediate action, such as placing the patient in a left lateral Trendelenburg position. Question 11. A patient with a central venous catheter reports pain and swelling in the neck on the side of the catheter insertion. What complication should the nurse suspect? A. Thrombosis. B. Catheter dislodgement. C. Catheter-related bloodstream infection. D. Pericardial tamponade. Answer 11. D. Pericardial tamponade. Rationale. Pain and swelling in the neck on the side of the central venous catheter insertion may indicate pericardial tamponade. This life-threatening complication requires immediate assessment and intervention. Question 12. A nurse is caring for a patient with a central venous catheter. During routine care, the nurse notices redness, warmth, and tenderness at the catheter insertion site. What is the appropriate action? A. Administer a prophylactic antibiotic. B. Document the findings and continue monitoring. C. Remove the central venous catheter. D. Apply a warm compress to the site. Answer 12. C. Remove the central venous catheter. Rationale. Redness, warmth, and tenderness at the central venous catheter insertion site may indicate infection. The appropriate action is to remove the central venous catheter to prevent the spread of infection. Question 13. A patient with a central venous catheter is receiving a vesicant chemotherapy infusion. The nurse observes swelling and blanching at the insertion site. What is the priority action? A. Administer an analgesic as ordered. B. Elevate the arm to promote venous return. C. Discontinue the chemotherapy infusion. D. Apply a cold compress to the insertion site. Answer 13. C. Discontinue the chemotherapy infusion. Rationale. Swelling and blanching at the central venous catheter insertion site during a vesicant chemotherapy infusion may indicate extravasation. The priority action is to discontinue the chemotherapy infusion to prevent tissue damage. Question 14. A nurse is caring for a patient with a central venous catheter. The patient reports difficulty breathing and chest pain. What complication should the nurse suspect? A. Catheter dislodgement. B. Pneumothorax. C. Catheter-related bloodstream infection. D. Thrombosis. Answer 14. B. Pneumothorax. Rationale. Difficulty breathing and chest pain in a patient with a central venous catheter may indicate a pneumothorax, especially if the catheter has inadvertently punctured the pleura. Prompt assessment and intervention are required. Question 15. A nurse is caring for a patient with a central venous catheter receiving continuous infusions. The patient develops a fever, chills, and hypotension. What complication should the nurse suspect? A. Catheter dislodgement. B. Air embolism. C. Catheter-related bloodstream infection. D. Pericardial tamponade. Answer 15. C. Catheter-related bloodstream infection. Rationale. Fever, chills, and hypotension in a patient with a central venous catheter may indicate catheter-related bloodstream infection. The nurse should suspect this complication and initiate appropriate interventions, including obtaining blood cultures and notifying the healthcare provider. Answer 7. B. Place a non-ferromagnetic securement device on the PICC. Rationale. Before an MRI, it is essential to place a non-ferromagnetic securement device on the peripherally inserted central catheter, PICC, to avoid interference with the magnetic field. Removing the PICC is unnecessary if appropriate precautions are taken.